What are all your medication options postpartum? Hey, my name is Kara. I'm a mother baby nurse and a mom of three. Now, I'm going to base this off of how my hospital does things, but obviously it's going to depend on the provider and it's going to depend on the hospital system. So it's very common whether you have a uncomplicated vaginal or a cesarean delivery that you get scheduled pain medication. Usually, so for us, it is ibuprofen, 800 milligrams, and Tylenol, an extra strength Tylenol. It's 1,000 milligrams, and you get those both every 8 hours scheduled. At my hospital, we will do Toradol for 3 doses after delivery, and then we switch you to ibuprofen. I've heard some doctors say that Toradol is kind of like liquid ibuprofen, so we'll give that for 3 doses and then switch you to a regular pill ibuprofen to give together with Tylenol. Most hospitals should always also have breakthrough pain medications or PRN medications available. At mine, we have everything from oxycodone to Percocets to Dilaudid to morphine. So it just depends and depends on people's allergies and stuff, but it's usually the option is 5 milligrams or 10 milligrams of oxycodone. This is also a great time to point out that one person over here might have had a C section or had a vaginal delivery with a tear, and another person over here had the same thing, but one person needs breakthrough pain medication, the other doesn't. It's very, very normal because everyone has a completely different pain threshold, has a completely different body. It might depend on how their surgeon did the procedure, it might depend if there was scar tissue there. So it really is not one size fits all, and it varies widely what one person may need may not be what the other person needs. And again, it's always your right to refuse something if you feel like you don't need it or just don't want to take it. That's also perfectly fine. We are always try to do non-pharmacological methods first. So if we can do things like a hot pack, distraction, massage, aromatherapy, literally there's all these things that we will try to do to help you before we need to do that. But if we need to do it, then we need to do it, and that's perfectly fine. We also just have standard orders. Everyone gets this vaginal or cesarean delivery, but they get a stool softener at night before bed. Some other really common ones that people need a lot of times after delivery, especially after a C-section, are anti-nausea medications like Zofran, or we even have Reglan that sometimes people will use. Occasionally, people need antibiotics. There's a chance a lot of people will need like blood pressure medications, which could be a previous condition they already have, or this is a new thing that they have post delivery, or like antidepressants, or just like anything really that they were taking prior to giving birth. A lot of times we will resume giving that. And another one that a lot of people don't know about until people offer it to them, but is Gas-X or simethicone. That's huge, especially with C-sections, because a lot of times that air can get trapped up in like your shoulders or your back and be really painful. So that's a good one to ask for if you think you need it.